It's almost midnight. You're finally about to fall asleep, and then you hear it. Thump, 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 thump. Your dog is sitting up in the dark, shaking their head over and over again, so hard their collar is jingling like a wind chime. You get up, you turn on the light, and you look inside their ear. It's dark red. It smells sour, almost like old beer or vinegar gone bad, and your dog won't even let you touch it without pulling away. If this is happening in your house right now, I know exactly how helpless it feels. You've probably already been to the vet once or twice this year for this exact same thing. You walked out with a tube of ear medication, it cleared up for a few weeks, and then, like clockwork, the head shaking started again. Maybe you're even wondering if this is just something your dog is going to deal with forever. Here's what I want you to understand before we go any further. Most recurring ear infections in dogs are not actually an ear problem. The ear is where you see the symptom. It is very rarely where the problem starts. And once you understand where it actually starts, you can support your dog's ears from the inside, not just chase the flare-ups from the outside every few months. Hi everyone, I'm your neighborhood veterinarian, and welcome back to the channel. Ear infections, medically we call this otitis externa, are one of the most common reasons dogs get brought into my clinic, right up there with skin allergies, and honestly, the two are almost always connected. Today, I want to walk you through what's actually happening inside that ear canal, why it keeps coming back even after treatment, and one simple daily bowl addition that supports the internal side of this problem, alongside the safe at-home care that handles the outside. I also want to be completely upfront with you early on, because this matters more than views to me. Nothing I share today replaces veterinary diagnosis or medication for an active infection. What this video gives you is the missing piece that most pet parents are never told about. The piece that helps prevent the next flare-up instead of just treating the one you're dealing with right now. Let's start with what's actually living inside your dog's ear canal. A dog's ear canal isn't shaped like ours. It runs vertically down and then takes a sharp horizontal turn before it reaches the eardrum, almost like an L shape. That turn is useful for protecting the eardrum, but it's also a trap. Warmth, moisture, wax, and debris settle right at that bend and have nowhere easy to go. Every ear, healthy or not, naturally hosts small populations of yeast and bacteria. In a balanced ear, they stay in check. The problem starts when something tips that balance, and the two organisms responsible for the vast majority of infections are a yeast called Malassezia pachydermatis and a handful of bacteria, most commonly Staphylococcus, and in more severe or chronic cases, Pseudomonas. So what tips the balance? A few things, and this is where most of the confusion comes from. Moisture is the biggest one. Dogs that swim, get bathed frequently, or have thick hair growing inside the ear canal, think poodles, cocker spaniels, and other curly or wire-coated breeds, trap humidity down in that canal. Breed anatomy plays a role too. Dogs with heavy, floppy ears like basset hounds, cocker spaniels, and labradors block airflow so the canal stays warm and dark, which is exactly what yeast wants. But the factor that gets left out of almost every conversation about ear infections is allergies. Environmental allergies to pollen, dust mites, or grass, and food sensitivities both trigger inflammation in the skin lining the ear canal. Inflamed skin produces more wax and oil feeds yeast, yeast overgrows, and now you have an infection. This is why a dog can get their ears cleared up with medication and be back in your vet's office 6 weeks later. The medication killed the yeast. It didn't touch the allergy that caused the environment for the yeast to explode in the first place. I want you to do something right now if your dog is dealing with this. Gently lift the ear flap and take a look and take a sniff. A healthy ear canal is pale pink, has very little visible wax, and has essentially no odor. If what you're seeing is dark brown, waxy, coffee ground looking debris, that pattern, combined with intense itching and head shaking, is often associated with ear mites, especially in younger dogs, and that requires a specific parasite treatment, not just a general ear cleaner. If instead you're seeing a yellow or grayish, thick discharge with a strong yeasty, almost bread-like smell, that's your classic yeast picture. And if the ear is bright red, swollen, nearly shut, and there's a foul, almost rotten odor with a lot of pain when you touch it, that pattern often points toward a bacterial component, sometimes both yeast and bacteria together, and it needs a vet visit and an examination, not a home remedy, because a bacterial infection deep in that canal can spread toward the eardrum and become much harder and more expensive to treat if it's left alone. I say this not to scare you, but because I'd rather you know the difference between let's support this at home and this needs a vet today. Okay, let's talk about what you can actually do. I'm going to give you this in two parts because ear health, just like skin health, is really an inside and outside job. Let's start with the outside because this gives you the fastest relief. If your vet has confirmed your dog does not have a ruptured eardrum, and this is important, please don't skip this step because putting liquid into an ear with a ruptured eardrum can cause serious problems. You can safely use a mild ear cleaning routine at home between vet-prescribed treatments to help manage the environment inside that canal. Veterinary ear cleaners work by breaking down wax and mildly altering the pH of the canal so it's less hospitable to yeast. If you want a simple, low-cost option your vet may approve for maintenance, a small number of ear cleaners use a very diluted, properly balanced acidic solution for exactly this reason, because yeast struggles to multiply in a mildly acidic environment. The technique matters here just as much as the solution. Never use a cotton swab down inside the canal. It pushes debris further down toward the eardrum instead of removing it. Instead, gently fill the outer ear canal with the cleaning solution, massage the base of the ear for about 20 to 30 seconds. You'll actually hear a squelching sound. That's the solution breaking up debris, and then let your dog shake their head. That shake does most of the work for you. Afterward, wipe out what comes to the surface with a soft cotton ball or gauze, never anything with a hard tip. Do this only as often as your vet recommends for your dog's specific situation, because overcleaning can actually irritate the canal and make things worse. Now let's talk about the inside, because this is the part almost nobody explains, and it's what the title of this video is pointing to. If allergies and skin inflammation are driving the ear environment, then supporting your dog's immune response and gut health becomes a meaningful piece of long-term prevention. Here's the actual science behind that connection, and I want to be honest with you about what we know and what's still being studied. A large portion of a dog's immune system function is regulated in the gut, and there is a growing body of veterinary research looking at the relationship between gut bacterial balance and skin and ear inflammation, sometimes referred to as the gut-skin axis. The evidence here is genuinely promising but still developing, so I'm not going to tell you a spoonful of anything is going to cure an active infection because that would not be honest, and it's not how biology works. What the research does support fairly well is that introducing beneficial probiotic bacteria can help modulate an overactive immune and inflammatory response, which is one of the underlying drivers behind chronic allergy-related ear flare-ups. So here's the one spoon. Plain, unsweetened kefir, or if your dog doesn't tolerate dairy well, a dog-specific probiotic supplement. Kefir is a fermented milk product loaded with multiple live bacterial strains, and a small amount stirred into your dog's regular food once a day is an easy, low-cost way to introduce that beneficial bacteria consistently. If you go the dairy route, you must check the label carefully. It has to be 100% plain, with zero added sugar and absolutely no artificial sweeteners. This is not optional. A sweetener called xylitol, sometimes listed as birch sugar, is extremely toxic to dogs even in tiny amounts, and it hides in a lot of flavored yogurt and kefir products, plain and unsweetened only. Start with a small amount, about a teaspoon for a smaller dog, or up to a tablespoon for a larger dog mixed into their dinner, and give their digestive system a few days to adjust before increasing it, since introducing new bacteria too quickly can occasionally cause loose stool. Alongside that probiotic addition, if allergies are part of your dog's picture, and for most dogs with recurring ear issues they are, adding a source of omega-3 fatty acids is one of the better supported dietary interventions for calming allergic skin and ear inflammation over time. A small amount of fish oil, or a couple of sardines packed in water with no added salt, mixed into food a couple times a week, supplies EPA and DHA, which have documented anti-inflammatory effects on skin conditions in dogs. This isn't an overnight fix. Most vets, myself included, tell owners it takes somewhere around 4 to 8 weeks of consistent omega-3 supplementation before you see a meaningful difference in skin and ear inflammation, because that's roughly how long it takes for those fatty acids to actually integrate into the skin cell membranes. Slow but real. I also want you to look at what's actually going into your dog's regular food, because for some dogs, ear and skin flare-ups are directly tied to a food sensitivity, most commonly to a specific protein source rather than grain, contrary to what a lot of marketing would have you believe. If your dog's ears flare up on a predictable, repeating cycle, it's worth discussing an elimination diet trial with your vet where you feed a single novel protein for a period of weeks to see if the ear issues improve. This is genuinely one of the most useful diagnostic tools in veterinary dermatology, and it's often skipped because it takes patience. But if allergies are your dog's underlying driver, it can change everything. Now, drying is the other piece people underestimate completely. After every bath and every swim, dry your dog's ears thoroughly. Not a quick pat. Actually fold the ear flap back and gently dry inside the visible part of the canal with a soft towel, and if your dog tolerates it, a hair dryer on the coolest setting held well away from the ear works well too. Moisture left sitting in that canal after a bath is one of the single most preventable triggers for a flare-up, and it costs you nothing but 2 extra minutes. Let's talk honestly about timeline, because I don't want to give you a false promise. If your dog has an active infection right now with pain, odor, redness, and discharge, please see your vet. Active infections typically need a prescribed antifungal or antibiotic ear medication, sometimes both, and trying to wait it out with home remedies alone can allow the infection to progress deeper into the canal, which becomes significantly more painful and more expensive to treat. What the routine I just gave you does is different. It supports the underlying environment so that once the active infection is cleared with proper treatment, you're not just waiting for the next flare-up to happen. Most owners who stay consistent with the gut-supporting bowl addition, the omega-3s, proper drying, and gentle at-home maintenance cleaning, start to notice fewer and less severe flare-ups over a period of roughly 1 to 3 months, not overnight, and not for every single dog, because every dog's underlying trigger is a little different. Some dogs need the diet trial, some need both the probiotic and the omega-3s. Some genuinely have anatomy working against them and will always need a bit more maintenance than others. That's not a failure on your part. That's just biology. One more thing I have to mention, because it matters for the dogs who need it most. If your dog's ears are severely swollen, if there's a strong odor that isn't improving, if your dog is tilting their head to one side and holding it there, or if you notice any sign of pain when you're nowhere near the ear itself, please don't wait. Those can be signs of a deeper infection or, in rare cases, a ruptured eardrum, and that needs veterinary attention right away, not a home routine. I would never want a video like this to be the reason someone delays care their dog actually needs. Here's what I want you to walk away with today. Ear infections that keep coming back are almost never random bad luck. They're usually your dog's body telling you something bigger is going on, whether that's an allergy, a moisture issue, or an imbalance that needs support from the inside. Clean gently and correctly on the outside, support the gut, and reduce inflammation from the inside with a simple daily spoon of plain kefir or a dog probiotic and a source of omega-3s a couple times a week. Dry those ears completely after every bath and swim. And if anything about what you're seeing tonight feels severe, painful, or is not improving, let your vet take it from there. I know how exhausting it is to feel like you're fighting the same battle every few months, but you're not failing your dog. You just needed the piece of the picture most people never get told. Give this routine a real, honest month, stay consistent with it, and pair it with your vet's guidance for anything active going on right now. What does your dog's ear situation look like tonight? Is this your first flare-up, or has this been an ongoing fight for you two? Tell me in the comments. I read through as many as I can, and if there's a detail about your dog's specific situation, someone else scrolling through these comments is probably dealing with the exact same thing and could really use hearing it. If this helped you understand what's actually going on, hit the like button. It helps this information reach more pet parents dealing with the same 3 a.m. head shaking you were dealing with tonight. Give your dog a gentle scratch behind the ears for me, just not too close to the sore spot. Stay safe, take care of your best friend, and I'll see you in the next video.